So in those patients with hypermutated, so hyperinflamed tumors, there's a higher likelihood to see a response from immune therapies. When looking across the board with single agent PD-1 inhibitors with pembrolizumab or nivolumab, there's no response in colon cancer. On the other hand, when looking at the patient population that has this MSI-H phenotype, you do see response rates up to 50 to 60% of the patients. And more interestingly, as we look over time, in a recent publication from the authors of the study that looked at pembrolizumab essentially in patients with MSI-H, a lot of the patients who had either stable disease or partial response ended up with complete response with time, an average of about 24 to 26 weeks before they actually had their response seen. So some of these benefits can be seen early, but they also accumulate with time, and many of these patients may end up with a complete response or a very solid partial response after half a year on the therapy.